In this section, we will review the analysis and reporting of clinical trials. And you will see that there are two main types of analysis: the intent to treat or ITT and the per protocol analysis. And you want to know what the difference between the two. They are very, very different. In the intent to treat analysis, you essentially treat the patient in the way it was intended to be. So if the treatment if a patient was assigned a drug A, then they should be treated and analyzed as if they received drug A, even though they might have switched to drug B or not completed the trial. So essentially what you can remember is that once randomized, always analyzed. This is a way to trying to maintain the randomization, because once you lose it, then all sorts of bias can creep into the study. And one of the things that you need to do then is, which sometimes if it's your first trial, you might not think about, is that you want to keep track of the participants even after they stop or switch their medications, which means you're going to track them unless they don't want to. But if they're, for example, they don't want to take the pill because they don't like it, it's too big or doesn't taste good, then you might ask the participant, is it okay to continue? Meaning that you still track their outcomes, you still track them all the way to the end, even though they didn't take the medication or they switched the medication. So if the patient is willing to, if the participant is willing to, you continue to track them so that you actually have an outcome at the end. And that outcome is for a patient to be considered in the way that it was originally randomized to. So if a patient was randomized to drug A, that's the outcome for a participant taking drug A, even though they didn't take it. And so be careful that the follow-up is critical in clinical trials. You may underestimate the effectiveness. That is it's a disadvantage, but you're willing to do that. The other option is to end up with a bias that you don't know which direction is going. In the per protocol analysis, you analyze participants based on what they received, and but this again, because now you're no longer following the original randomization, you could introduce bias into the study. So there are strict reporting guidelines starting from the protocol. You can see the spirit statement that describes the minimum set of elements that you want to include in a protocol. And the protocol needs to be registered with, if it is for a drug trial, you want to register it with clinicaltrials.gov, and then you want to follow it. If you do not register the protocol and then try to publish the paper, it will likely not be accepted. In addition, if you make changes to the protocol, you would need to explain in your final paper why you made changes to the protocol. Once you have the protocol completed, you can use the consort checklist to report your clinical trials. But actually, what I have been doing is using the consort checklist not only to report the trial, but also, if that's what you need to report, you also need to include it in your data collection, in your design. So use the consort at the beginning of the study, the same as you would do for you would use the STROBE guidelines to design your observational study. And many journals now require the consort checklist to be included as a separate item when you submit your paper on a clinical trial. And also they require a flow diagram to be submitted as well. So the best thing to do is to use the consort from the beginning so that you do not miss anything, any elements that would need to be reported at the end. Here is the consort flow diagram. And take a look at that. And then is there anything that strikes you about this diagram? Well, you can see that we start from enrollment, this from assessed, for eligibility all the way to the analysis, which means you're gonna follow the participants from the very beginning. One of the mistakes one may make is that if you are excluding them, that you do not care. But you see, like, you need to know who's been excluded, why they're being excluded, what is the reason. So keep track from A to Z all the way down to the analysis. And then you randomize the participants, and then every time you lose some, you will need to know why they're lost, how many they're lost. Like, see here the number, the reason, all the way through the end to find out exactly how much bias are you introducing into your study. So in other words, pay attention to the missing data as much as you pay attention to the data that you collect.